Welcome to MYA Confidential. I am your host, Krystina Jones, and I am joined by
Chloe Beresford. I am the CEO here at MYA.
We are here to educate and explain about cosmetic surgery. We're going to dispel myths. We're going to change perceptions. We're here to reassure patients who are embarking on or within their journey with MYA. And we are going to have fun. We're going to be speaking to patients, speaking to listeners, allow them to become part of the MYA brand and community. This is a family-owned company. We're approachable.
And we want you to be part of the MYA family too.
And here we are, back again.
In our little pink spot.
And imagine, everyone can hear us wherever they are. What are you guys doing?
Yeah.
Are they cleaning?
I hope not. I hope they're just...
Where are you listening to MYA Confidential? I'm actually very intrigued.
Well, I hope in a way they're listening and they're actually, like, on a journey, I think it's a nice time to listen to a podcast.
Yeah.
When you're in the car on your own, you haven't got any distractions, no kids.
Yeah.
No
I would love
husband, no nothing.
Our patients to be listening to this in the clinic waiting room or when they're ready for their operation. You know, they're waiting, their admission time's at 8. You're not going to go down probably till about 9, 10 o'clock.
You can listen to
us beforehand.
I know.
That's pretty cool.
Yeah.
But anyway, today we're going to be talking about cosmetic surgery, obviously.
For a change.
We're going to
we don't talk about that much.
I know. We should talk about our clothes instead. We're going to
We should talk about shopping.
Yeah. What have you bought recently?
I'd like to have bought more. Haven't bought much actually recently, but anyway.
We need another
hopefully Santa will be good to me this year.
Yes. And then we're going to go through our usual segments, Dear MYA, and let's kick things off. So, have you seen in the news recently, there is a lot on the cosmetic surgery side abroad, some horrifying stories. I sent you one a couple of weeks ago, didn't I? And
yes,
it's actually heartbreaking.
Oh my goodness, yeah, absolutely. I keep seeing like numerous articles that greatly disturb me. As a CEO of a cosmetic surgery provider, I don't know how these companies are getting away with it.
Yeah.
I don't know how it's legal anywhere in the world. But obviously, you know, you have to look at these countries and you have to realise that they're not in what, you know, a governed environment. So obviously in the UK, probably a lot of our listeners maybe don't really fully understand what the CQC is.
Yeah.
And it's obviously the Care Quality Commission.
Yeah.
And they are the governing body in the UK that's going around making sure that every medical establishment going is doing the right thing.
Yeah.
I mean, they're in the NHS, they're everywhere. So every hospital will get inspected. I suppose it's a bit like when Ofsted go into like your kids' school.
Yeah.
And sometimes your kid's school gets a really kind of, poor
needs improvement.
Needs improvement.
You don't want that one from a cosmetic surgery provider, do you?
Or then some of them get, excellent and things like that. We obviously have outstanding.
Which is insane. And there's so much that goes into it as well.
Exactly. But you've got to remember that when you're going abroad to a provider in maybe Turkey or wherever it may be, they won't have that infrastructure in that country. So that's going to be very risky, in my opinion, because there's nobody who's overseeing what they're doing.
And how they're doing it. It's going to go into the clinical side. It's going to go into patient safety. It's going to go into what's going in their body.
Yeah.
There's just so much within it. Like, even from a small aspect of telling cosmetic surgery providers that you need to offer a chaperone.
Yeah.
To the, the highest kind of thing of the grade of equipment that you're using during surgery.
Yeah.
None of that has a regulation to it when it's abroad, but that is exactly what we adhere to day in, day out, and it's what keeps our patients safe. It keeps us safe. We've had the surgery here.
Yeah.
And you then have that trust for that company that you're having cosmetic surgery with. And that isn't going to happen abroad, especially if you can't even read the terms and conditions that you're signing.
Really, it's cheap
Yeah.
It's cheap surgery, and it's cheap for a reason.
Yeah.
And that's because they're cutting corners. And whether it's the aftercare, whether it's on the anaesthetist, whether it's on the quality of implants, whatever it is, they are cutting corners because it can't really be that cheap.
If there's a small price to pay, what are they cutting for those costs? Because we know exactly how much everything costs.
Yeah, well, they're doing things, like I said previously, like with the blood transfusion story that I was reading about, where a woman received the wrong blood group.
That is insane.
And that's because they're not making sure, they're not checking the patient's blood group first. They're not making sure that that blood transfusion would be available if that patient was to, get into distress during a procedure.
Yeah.
They're just not thinking of the things that they should be thinking of. And the interesting thing is, and this is where I'm actually a bit confused, because it's getting much more media coverage than ever.
Yeah.
But people are still going.
Worryingly. Yeah.
So it's like people are reading this. They're reading about, these Brazilian butt lifts that have gone wrong. People have died on the table. The gastric band, the gastric sleeves. People are getting fed through tubes when they come back to England because they no longer have a digestive system. They've had nearly 90% of their stomach removed. They're unable to even process solid food. They're living off yogurt now and drink. It's absolutely appalling. People are reading this in the media. It's all there, the Daily Mail, everyone's talking about it, saying how bad it is. But then we still get people who would come to us, see us, and then they may go, oh, I've decided to go to Turkey because it's cheaper.
Expensive.
And I just think to myself,
why would you do it?
What else can we do other than making people aware? And this is probably one of the main reasons why I wanted to try and educate patients, because I think people need to know how bad it is in certain countries and how slack these people are, these so-called doctors or whatever, medical people working in the hospital that clearly don't care. The most disturbing one for me, which is a huge problem at the moment, is the organ harvesting.
Oh, it's disgusting.
And we have a girl who works for us. I think it was a friend of a friend had gone to Turkey for a procedure. And then she came home. She had a kidney infection. So she ended up in A&E, went back to hospital, obviously back in the UK at this point, to discover that she only had one kidney. And they'd taken a kidney during her procedure.
My God.
And they cover it up by saying things like, oh, we had to do some skin graft, we had to take some skin off, and this, that, and the other.
Or they say it's drains, don't they?
Yeah, things like that. They've taken a kidney. The organ harvesting is rife out there. And if anyone Googles it, looks into it, they can learn about it.
Would you go and have your knee replacement done in Turkey? No, you'd go through the NHS or you'd go through private surgery.
But that's because it's free.
But you wouldn't then go abroad.
No, I think the problem is people are all about how much it costs, aren't they?
Yeah.
Everything's down to cost. It's when you buy a house, a car, whatever you spend, it's down to price. Price determines what you get. And sometimes, if you want quality,
you've got to pay for it.
You've got to pay for it.
Yeah.
And when it comes to your health, compromising on quality, in my opinion, not even just in cosmetic surgery, in anything, it's not worth it.
Yeah.
Because it will come back to bite you on the bum. And in this case, it will come back in the form of probably a nasty infection. Mm-hmm. It could be just long-term health problems. I've seen those cases recently, like I say, with the gastric sleeve, people that can no longer process food. They can't actually digest food properly anymore. And that's horrendous.
Horrible. And that is life-changing in the complete different way that you don't want it to be.
Yeah. So they may have lost weight.
Surgery to make yourself feel confident. And then actually in what you're doing, you're creating a much bigger problem because this has now happened because you haven't researched things properly.
Yeah.
You haven't looked at things. You haven't done research into 3, 4, 5 providers maybe.
Exactly.
And looked into it that bit more to then make a proper informed decision. Yes, I value my body. I value my life. I am going to have it done here in the UK. I'm going to have it done with a reputable provider, a reputable surgeon. I know exactly what they're doing. I know their CQC rating. I know how the surgeon's registered, their insurance, their everything. You've got all of that. And then gone, right, okay, this is what I want to do.
Exactly. And then, and God forbid, if something does go wrong, because the thing is with surgery, things can happen sometimes. Yes, you can get an infection. Sometimes you don't get the result you want. It ends up in a revision. These things do happen from time to time. At least if you are with a provider that is going to make sure that you get aftercare, you're going to have somebody to go to, you're going to be able to get the care you need, whether it's an infection, a return to theatre, or a revision, whatever it may be, you're going to be able to get that.
And it's getting that reassurance too. So like with me, as I've said, had my op, was it 4 or 5 weeks ago?
Yeah.
At one point I did think, oh, do I have an infection? Went in, saw the nurse within 24 hours, swabbed it, came back. No, you're absolutely fine. If I had then had my surgery abroad,
where would you have gone?
How on earth would I know? Where would I go? The NHS aren't going to want to see me. And why should we then be putting that implication on them too? And you don't know what's going on. You don't know how you're healing.
Yeah.
You're then going into a tizzy yourself anyway.
Yeah.
It's not worth it. It's so not worth it.
But I think the problem we have is allowing people to understand that it's really not worth it. I think this is where you and I doing this and talking to people and actually telling them the bare facts that, even just the length of time in the UK, you have to be qualified.
Yes.
Even to put someone to sleep, it's so many years to be able to do that on your own as an anaesthetist in the UK.
Yeah.
Whereas abroad, it's a lot less. So you're getting somebody who's putting you to sleep, who's nowhere near got the experience that somebody over here as an anaesthetist is going to have when they put you to sleep.
And half the time you're meeting the surgeon on the day or 24 hours before.
That you don't even know him.
Like, to me, is just insane. Like, you don't know anything about him.
No. And they don't really know anything about you either. Because, over here, when you think about, our patient journey and the medical history, and obviously we require a GP summary just to make sure, a patient's general health.
And we ask that from the get-go, don't we?
We do, yeah. And also if there's things like, so many people nowadays, are on things like antidepressants, lots of forms of anxiety medication. But you need to make sure that if you have changed your medication, that you've been on it for a stable period of time.
Yeah.
You can't just go on to a new drug, be on it for 6 weeks, and then go, oh, I've decided to have surgery now, because your mindset...
They're neurological, aren't they? Yeah.
Exactly. And we look into stuff like that, and we make sure that people are ready, and that they are on stable medication, and that they are in a good mental place to say, yes, I want to have this done to my body.
Yeah.
Whereas unfortunately, in places like Turkey, you could literally have somebody who tried to take their own life one week, and then the next week they're getting cut open on a table.
It's insane.
And they literally are not in the right frame of mind to make any decision.
No.
Certainly not a decision about having an operation.
Yeah.
It's
scary.
It's scary, and it is very, very difficult to kind of make sense of. But I do hope that anyone listening to this will realise the dangers of going abroad.
Yeah.
Even if they don't come to MYA, this part of the podcast for me, it's not about saying, although in my opinion, obviously, I do think we're a very good provider. I think we offer the best service, and I think we have the best surgeons.
Hell yeah.
Of course. And I'm going to always say that because I'm slightly biased, obviously. Just slightly. But even if I had a friend who said to me, Chloe, I'm wanting this done, but I didn't really want to come to MYA. I didn't really like the surgeon I saw, or I can't really afford it. You're a bit more expensive, whatever. I don't know. I would never say to a friend, okay, go to Turkey.
Absolutely. No, there's no way you'd do it, would you?
I'd just be like, well, whatever you do, don't do that.
Yeah.
I don't care, go to whoever, but don't do that.
Yeah.
Because that really it's a bad choice.
Yeah. It's the worst choice.
It's the worst choice
ever.
And I think if anyone is thinking about it, the best advice I could give them is just to start Googling the organ harvesting and the amount of deaths that have been registered, and also the cost implication that surgery abroad has actually had on the NHS. I mean, it's millions of pounds, I think it was. Last year was, I mean, I can't even remember the figure, but it was high.
Yeah. And the thing is, like, talk to us. As we've said before, it will be in the show notes too. If you want to have a conversation with us, you want to talk about surgery, click on the link. We can go through things with you.
Absolutely.
We can put your mind at ease. We're here to talk. We're here to help. That's what we're here for, basically.
Yeah.
So with my role and with the new girls that start with us, with the training sessions, I'll actually say to them to do some mystery shops. And recently, did you hear about the mystery shops that one of the girls did at a competitor's?
No, I don't think I've heard about this one.
Well, let me tell you. So, you know, for us, every surgeon consultation will always offer you a chaperone. A chaperone is there. It's there to be safety for the surgeon, safety for the patient. And it kind of just like helps set the tone, doesn't it?
Yeah.
They'll help with
Well, we don't actually even offer one. We actually just put one in there. It's not actually negotiable.
Meet your chaperone.
It's like, here's your chaperone. She's going in with you, which is how it should be.
It's quite nice. We'll introduce you to the surgeon, take a seat, enjoy.
Yeah.
Well, this PC went to go to a competitor, and when she was there, she went into the room, she met the surgeon. There was no chaperone. A chaperone was not offered at all.
Wow.
Then, during the consultation, she was asked to take her top off. As you do, you have an examination.
Goodness.
But she has just sat there with her top off.
In the chair?
Yeah. With the surgeon.
Was she not even behind a screen on a bed?
Nothing.
Oh my goodness.
And then I felt bad that we'd put her in this position.
I'm very sorry.
It's, mind blown again. So,
and that's actually a UK
and this is in
provider.
The UK.
Was that a cheap provider?
Yeah.
Yeah. Okay, well, that's you see, that's an example of cutting costs.
The pricing.
Staff, everything. It's reducing everything down to a bare minimum, isn't it?
Yeah. You know, you can get any car.
Yeah.
But everyone would prefer a Mercedes. And here we are.
Yeah, exactly. Yeah. Here we are to advise.
Yeah, definitely.
On what type.
And to guide. So, dear Maya, we've had some coming in the past couple of days, and this one I found really entertaining, so I think you'll like it too.
Okay.
So, for us, being in the industry that we're in, do we know when a celeb has had cosmetic surgery?
Oh, I think my...
Absolutely.
I think my boob dar is pretty good.
Yeah, instead of a gaydar, we got boob dars.
I think it's on
and
point.
And a nose dar.
Yeah. And definitely Vaser.
Yes.
100%. Because it does make me laugh, especially with like the Kardashians and things like that.
Yes.
I mean, I look back at, especially when I think it was Kylie, the young one, when she said, oh, I haven't had any breast augmentation and I haven't had anything done to my bum. And you look at a picture and there's like a 12-month difference, right? And basically the one picture, she just is flat. Like, she's very slim. I mean, she's lovely and slim, but she's just flat. You know, she's quite flat-chested and her bottom is quite normal.
Yeah.
Nice kind of shape, but very, very small and quite flat. She just looked like a normal young woman. Very nice, nothing out of the ordinary. A few months later, it was almost like a caricature had happened. These, you know, double D breasts suddenly appeared with this bum. She's obviously clearly had filler in her lips that she doesn't want to talk about, and she wants to say it's down to the lip kit so that all these young people like my daughters go out and buy them, when actually it's called filler.
Yeah. She did say that she did do it in the end, though, didn't she?
I think in the end she did, but I know at first, because I remember when I think it was Kim Kardashian as well, was saying, oh, I haven't had implants in my bum. Well, no, she hasn't. No one's saying she has, but she's clearly had fat transfer.
Yeah, and you've contoured the hell out of the rest of your body.
The whole body has been contoured. You can see where the Vaser is. You can see where the incisions were. You can see all the differences on the face. You can see the cheek filler, the jaw filler, the lip filler, the enhancement goes on and on and on, and the list is endless.
And I think the thing that, from a public to celeb side, the thing that wouldn't annoy you as much is if they were more open with it, but that they weren't trying to sell something on the enhancement.
Yeah.
So I remember when I first started working here, a celeb, I'll put it in inverted commas, had cosmetic surgery with us, and they'd had liposuction. Can't say who it was because it was done confidentially. However, I then saw in a magazine that they were then promoting how they'd lost X amount of weight through doing, I've done this with my new exercise regime. And I was like, no, you haven't. You had Vasa about 6 months ago. And it's that lying. And I think it was from then that I thought, well, I'm never really going to worry about my weight again, because I know that actually what they try and sell probably isn't true.
Yeah.
And it's quite sad, isn't it?
It's very sad. And it's very sad. And it's sad for young people who are probably quite heavily addicted to social media.
Yep.
You know, that age category of, I don't know, maybe 12 to 20, where they're glued to their phones. They're looking at all these images constantly of, beautiful women on Instagram. And I think it's quite disconcerting, actually, because what you're seeing is not actually a true interpretation.
100%.
Sometimes these women on there are trying to pass off their bodies, their faces as totally natural, like they've just been born this way, and isn't this wonderful? They shouldn't be doing that. But then on the other hand, you could say, well, why do they have to tell people they're having surgery? Why do they have to talk about it? They don't have to, but I think if you are going to shove yourself down people's throats on social media, I personally feel you have a public responsibility to young people that are looking at that kind of material to be honest and
be
truthful.
Transparent about it.
Because when Kylie Jenner was asked certain questions, I personally think in the beginning, I don't know later on what came out, but I definitely think in the beginning she probably wasn't being truthful, and young girls were probably looking at that thinking, oh, isn't she lucky? She's got really big lips, she's got a big bum, and now there's all young girls on TikTok who are dancing around, shoving their bums out, putting padded bras on, but trying to look like that, aspiring to this, curvaceous image. That has been done on a surgical table with possibly a very, very skilled surgeon.
Yeah, definitely.
And it's not going to happen overnight. Do you know what I mean? That's how that's come about. And also, even just, when you look at social media as well, filters.
The filter and the amount of patients that we get in saying, I want my nose to look like this because this is how my filter does it. Oh. That in itself is like, whoa, okay.
Yeah.
Like,
I'm
this
so
is what a filter can do.
I'm so sick of people showing me a filtered image. I'm sick of seeing it. I don't want to see it. I'd rather you just don't take a picture of yourself.
Yeah, I just want to see the real you.
Yeah. I look at some people's social media, and you know what? The odd one, I don't mind the odd filter. The odd one, if it's a really good one, and I'm like, oh, look at us. We all look amazing. We'll look about 15 again. Isn't this great? And, make a bit of a joke of it, and it's the odd one. That's fine. But
when
if
it's constant.
You are constantly, some people have the whole Instagram with numerous pictures and every single one is filtered.
And you know that they don't look like that when you see them in real life.
Oh God, yeah. And they do these other things. My daughter, who's 19, she was telling me, she's got friends who are always putting pictures up and things, and she's like, oh yeah, you can do this, you can do that, and I'm like, really? And she'll be like, yeah, they just pull the waist in, make their lips look bigger, and it's literally, she showed me how they do it, and you basically get your picture and you make it look
the morphing, isn't it?
Yeah, it's mental. So then what happens then is that image then gets put out into the public, as it were,
media,
because especially if they've got an open profile, everyone's looking at it and everyone's thinking, oh, they're so naturally lucky, how beautiful they are.
Yeah.
When actually it's just a filter, or it's something they've had done and they're not being transparent about it. And that, for me, it's a tricky one, because when people are putting that out there, everyone's got insecurities anyway, I think.
Yeah.
So everyone has insecurities with their body, with their face, everything. And I think what happens is when you see a lot of highly filtered material on Instagram, it probably makes you feel worse about yourself.
Yeah.
I don't know if that then leads people to think that surgery is the answer, but people shouldn't be having surgery just because they're looking at somebody else.
And that they're looking to become a certain filter.
Yeah, or they're
They
looking...
need to be doing it for other reasons
They
other
need,
than...
yeah, absolutely. They need to be making those choices because they genuinely are unhappy with a part of their body that they feel they want to change. And I think that is what's important here, having cosmetic surgery for the right reasons.
Yeah, it's not a fashion.
Yeah, it's not a fashion. It's not feeling pressured into it just because you see somebody with a fantastic filter on Instagram and you think, oh, I want to look like that. Oh, I'll just go and, like some people copy celebrities, don't they?
Yeah.
There's these funny cases in America where, you get girls turning up going, oh, make me look like Kim Kardashian. Mm-hmm. And it's just, it has to be realistic to you.
Yeah.
And sometimes looking at highly unrealistic material isn't the way to make the best decision about how you feel about yourself. I do wish, though, getting back to the likes of, say, Kylie Jenner and things like that, I do wish when people, because she looks fantastic. I mean, let's face it, she looks hot.
Yeah.
Like, she does look insane. She's had surgery, but she looks amazing on it.
Yeah.
So what would be really nice is if she just said to everyone, yeah, I've had this. It's really good. And then people will look and be like, oh, okay.
Because
she had
would have
that.
had it for a reason. She would have thought, well, Kim looks like this, or I don't have a bigger chest. I wish that I did. I wish that I felt more feminine.
Yeah. I wish that I looked curvier.
Yeah.
I'm very straight up and down. I want to look better. So I'm going to have this. I think when people are dishonest, who are heavily in the public eye, which she is, and she's heavily promoting herself constantly. If you're doing that, I think you should be honest.
Yeah.
If you're just a celebrity who's just going about your normal day-to-day life, it is nobody's business, really. You can do what you want with your body. Yeah. But I just think if you're trying to overpower people with imagery of yourself looking exceptionally different to how you once looked, and almost passing it off as, this is just how I am.
I magically woke up one
day. I don't
like
really
this.
think that's very responsible, in my opinion.
No, I agree.
So I think that, the positive is, yes, cosmetic surgery is a great thing, and we can all make ourselves look different, and we can all make ourselves look the very best we can. But do it for the right reasons.
Yeah.
Don't just be influenced by some of the rubbish that you may be looking at on social media.
100%.
Make your own decision about what's right for you. And that really...
Get all the information possible.
Yeah.
And go from there.
Yeah.
Let's go into another question. So, rhinoplasty. So, patient has asked about rhinoplasty post-op. How does it work? You see a lot of pictures. They literally look like they've been through about 5 rounds of Mike Tyson. However, it doesn't feel like that at all. It literally looks like you've got all of the packing in. It looks scary. But all of the patients say post-op, it feels so easy. Like, it just looks so much worse than it actually is.
A lot of people who have rhinoplasty are actually amazed at how little pain they're in.
Yeah.
Because when you think about what they do, they break your nose.
Yeah.
So you would think, oh, this is going to hurt.
That'll hurt.
Yeah.
It doesn't.
I know. It's quite strange, that, isn't it?
And you have the packing. So it basically looks like 2 little tampons up your nose.
Fabulous.
It's beautiful. And then a kind of like hard cast.
Like that
on top of the
gauzy
nose.
type thing over.
And then plasters all to the side.
Yeah.
Yeah, it looks really scary. But then 10 days post-op, you'll have the cast taken off. You'll have those packing bits taken out. That's normally taken about 24, 48 hours post-op. And then you get to see your result. And it's incredible. Like, being there, I remember when I worked in Cardiff, my room was right opposite the nurses.
Yeah.
And so then when the patients would come out, I'd be able to see them like straight away. And seeing the patients, like the beaming smiles, that is the best part of the job.
No.
It
I do
definitely
think
is.
with rhinoplasty, it's it's a massive difference, isn't it? And the thing is as well, people... we talk about, obviously celebrities and surgery. That's another thing that I'm quite good at spotting as well. I am good at spotting who's had a nose job because they get that, it's like a slope. It's like a natural
difficult to
slope.
tell because unless you can like go right underneath their nose, can I just see if you've got some incision sites there? It's not the easiest one to spot, is it?
I think you can just tell, especially in America, they do that typical
the tip lifter.
Where the tip's slightly lifted, it's very, very slopey. It's
the ski slope, the pinched in tip.
Yeah.
Not quite Michael Jackson.
Yeah, but like Kris Jenner, she's had another rhinoplasty, I think, quite recently.
Yeah.
And Khloe Kardashian. And there's...
the fact that she tried to say that she didn't have a rhinoplasty. It was
they're very typical. They're typical, like, American cosmetic surgery procedures, I think, where you can really tell.
Yeah.
But I think with the UK ones, we're a bit more subtle.
Yeah. Rhinoplasty is amazing. Like, when you think of how meticulous it is, what a small area it is, and how much they can make a difference, literally from building it from the inside out.
Yeah.
And we'll go into like that in another episode as well about how rhinoplasties happen. But it's an incredible procedure. Facial surgery is amazing. And it's
facelifts as well.
Oh, yeah.
I mean, somebody we know, their wife's had it recently, and she's like in her 70s.
She looks about 30.
And she looks insane. When I saw her, I was literally like, oh my goodness. Looks really natural as well.
Yeah.
Because you do get sometimes, especially, I know when I've been to LA before, you see those like horrors.
They're scary.
Where it's pulled back, where it looks like the wind is like constantly blowing in their face. I don't think that's a good look.
No. And that's not what we do here. No.
So we're not promoting that.
So to this patient that's texted in, it will be, you'll have your cast on 7 to 10 days. It will be removed. You have the packing removed, and then you get to embrace your new face, basically.
I do think, though, it's important that when people have rhinoplasty, that they realise that the result that they see the minute they take off their dressing is not necessarily going to be the permanent result. You can get things like swelling. People get it on the tip where it looks like bulbous on the end of the nose, and they're like, oh my goodness, is this how it's going to stay? But over time, it goes, everything settles, and within 6 to sort of 12 months, I'd say, you have your permanent result when everything is settled. It's still exciting because it's still, for a lot of people, that's a massive difference, especially if you've had a very prominent nose where you've maybe had a slight bump or something like that. And then all of a sudden you take off the dressings and it's just a transformation, isn't it?
Straight little pixie nose.
I know. It's nice. Nice feeling.
Those ones are good. But I think that's everything that we've got for today. And it was lovely to talk to you again, my darling.
I know. And we'll be back. It won't be that long before there's another one.
Here's to the next one. Thanks everyone for listening. Please hit the like and subscribe button.
And please follow us on all of our cosmetic surgery social media channels.
At MYA Cosmetic Surgery. You'll find us on TikTok at MYA Cosmetic Surgery. Share this episode with a friend and anyone that you think will love it.
Thanks, guys.
Bye.